Hello everyone, welcome to the Nature and Lifestyle channel. My name is Mordecai. Please kindly subscribe to our channel. Hello guys, let's talk about how you can work as a healthcare assistant in the UK. My name is Mordecai. This is the Nature and Lifestyle channel. Welcome to today's video. The process is easy, but you can get it all wrong. There are a lot of people who are eager to work as healthcare assistants in the UK. What I would say is you have to be patient, you have to do a lot of research, you have to do a lot of reading. There are a lot of scammers around, a lot of fake agencies, I repeat, fake agencies who are looking to extort money from people, all in the name of getting them from their home country to the UK to work as health assistants. Just bear in mind that the Care Quality Commission, which is the independent body that supervises the health and social care sector, they do go from care homes to care homes to do some inspection, and as part of the inspection, they want to make sure that all the people who are working in the care home are qualified to work in the care home. If they find out that you are not qualified, what they will do is sometimes they will suspend the care home, and other times they will just alert the home office. And I know a lot of people who have been sent back home because they didn't have the right requirement to work as healthcare assistants in the UK. Just bear this in mind. Let's look at the requirement to work as a healthcare assistant in the UK. I will group the requirement into two. The first part of the requirement is the one being required by the agencies and the care home. The second one is the requirement you need to apply for the visa. Before I start, let me speak about agencies. I said that there are fake agencies. Whenever an agency contacts you in the name of taking you from your home country to the UK to work as a healthcare assistant, you don't have to pay a dime, you don't have to pay a penny. You don't have to pay a pound or a cedi or whichever currency is it. You don't have to pay any money to work as a health care assistant in the UK. If that agency tells you you don't need any English exam, it's a lie. It is a complete lie. So one way of seeing a fake agency is the one that comes to you to say, I can get you to the UK to work in the healthcare sector without any English exams. Guys, this is a lie. You don't have to believe this. Another thing about the duration. If they tell you, oh, within a month, within 2 weeks, we can get you a visa to work in the healthcare sector in the UK, that is a fake agency. You don't have to join that agency. So just bear this in mind. There is actually a website. There's actually a website that you can go on to check if a company is legitimate in the UK. There's a website, and I'll leave the link to that website in the video description. You open the website, you put the agency's name there, and it will tell you that this agency is legitimate agency in the UK. If you don't find any information about the agency, it means that agency is fake. So just bear in mind, it means that agency is fake. Now let's look at the requirement. Let's look at the first set of requirements. To work as a healthcare assistant in the UK, you need a senior high school certificate. So example is the WASI certificate or the SSCE certificate. I don't know how they call the senior high school certificate in your home country, but whichever name is given to it, just bear in mind that this is the first requirement. Another requirement is You need a valid traveling passport. You need a valid traveling passport. You need it in your visa application and also during your application process to the care home or to the agency which is ready to help recruit you to the UK. Bear this in mind. You have to get some form of education. No matter your education in the healthcare sector in your home country, you also need some form of training in healthcare assistance in the UK. This training will mostly be organized online. Now, those organizing the training need to be accredited companies in the UK. So whichever company is organizing the training need to be an accredited company in the UK. If you don't have this training, your recruiting agency will mostly organize this training for you, or you can also personally organize this training for yourself. Okay, you can personally organize this training for yourself. Again, I will leave a link to the site that organizes this training. Another important requirement is you need an experience in the healthcare sector in your home country. You need to be working in a hospital or a polyclinic, a district hospital, a community hospital. So whichever hospital is it, whether a health center, you need to have some experience in the healthcare setting in your home country. This will help you familiarize yourself in the whole healthcare setting, because if you travel to the UK and you have absolutely no experience in the healthcare setting, please, you will be very hot. You will be found wanting. You will be very confused. Everything will look new. You wouldn't know what to do. That is why it is important to first of all get some experience in working in any health facility in your home country. Now, when you also work in a health facility, there will be a point during your application that you need to provide some references. Now, these references are being provided by your superior, and this can be the matron, the DDNS, can be the ward in charge, or that nurse who has a higher rank than you at where you work. Most hospitals across the world, or most health facilities, will not give you a reference if you've not worked with them. I don't even think it's legal for somebody to give you a reference if you've ever not worked with a person. But having said this, you can also get your reference from the school that trained you to be a nurse. So from that educational institution, whether the university or the nursing training college that you had your nursing training at, okay? Also, some agencies require that you get a driving license. Not all agencies, I have to say, some agencies will not bother about this, but I know there are a couple of agencies that want you to get a driving license before they recruit you to the UK to work as healthcare assistant. Why do they want you to get a driving license? This is simple. So in the UK, when you work in the health sector, you would either be working in a hospital, in a care home, in a community hospital, or in a community setting. So if you work in a community setting in the UK, it means you'll be moving from house to house to assist people with healthcare needs. So you'll be moving from one house to the other to assist people with their healthcare needs. Now, before you move, you need a car. You need to be transported. No one is willing to transport you. You need your own vehicle. That is why some of these agencies want you to get a driving license from your home country before they recruit you to the UK. Just bear this in mind. Now, this is not a strict requirement. Personally, I think you need some form of nursing education. So if you've had, let's say, 2 years of nursing education or 1 year of nursing education, it will boost your CV, and also you'll be in a better position with the care home or with the recruiting agency actually recruiting you. So let's say there are 10 people who have applied from their home countries to work as HCAs in UK. Now, out of these 10, if let's say 4 have some form of nursing education in their home country and the other 6 have absolutely no nursing education, there is more likelihood that the 4 who have some sort of nursing education will be recruited. Okay, so I think personally it is advisable that you need some form of nursing education. Prepare your CV. Your CV has to be prepared. Your CV has to be prepared. Now, the CV here, you need to state where you've worked. You need to state your work experience, the number of wards that you've worked, the specific ward that you've worked at your health facility. You also need to state the number of years you have been working in the healthcare sector. It will make your CV very rich. Remember, when an agency puts out an advertisement that, oh, we need so and so number of ACA to work in the UK, you are not the only one who will be applying. There will be a lot of people who will be applying. And sometimes when you have the same qualification as these people applying, it will come down to certain details. That is why you need to put every detail of your work in your CV. The number of years you've practiced nursing, the number of wards you've worked, which hospitals have you worked with, which area of specialization have you also worked. These are all important facts to put in your CV. Now, let's look at the other form of requirement that the UK Home Office or the UK Immigration Office is asking. What do they require of you before they can issue that visa to you? I have spoken about this already. You need a valid traveling passport, so I'll not go deep into that. You also need a job offer. Now, the job offer here is not only specific to healthcare assistant job. Generally, if you are coming to work in the health and social care sector in the UK, you need a company, a hospital, a care home, a community hospital, or any other company in the health sector be prepared to give you a job when you arrive in the UK. If you don't have a job offer, they will not give you your visa because the company need to generate something that we call COS. They need to apply for a COS for you. Now, the COS is just certificate of sponsorship. It's a certificate that shows that they are prepared to sponsor you, they are prepared to employ you. On the certificate, they will state how much money they will be paying you per year. On the certificate, they will state how many years they will be employing you, okay? And they will also sometimes state what you'll be doing at work on the certificate. Other times, they also do state that they will take care of your personal needs in the first couple of months. So sometimes they state that on the COS. So as I have said, you need a job offer from a reputable health facility in the UK. Now, someone will ask me, what about the agencies? The agencies only come in to recruit you to the UK when they have job offers. So the agency is like a middleman, okay? The middleman or the middle institution. They will assist you throughout the process, okay, to get to the UK. When you get to the UK, they'll just hand you over to the health facility that you're going to work with in the UK. Just be mindful of this. Now, this is why you don't have to pay any money to any agency, because the health facility that they are going to give you to work, or the health facility that you're going to work in, will pay the agency all the costs that they incurred during your recruitment. So do not pay any money to any agency in the name of getting you a job as a healthcare assistant in the UK. The Home Office will also ask for a police clearance certificate, from your home country. Or if you've lived in any country for more than 6 months, they will also ask a police clearance certificate from that country, okay? From that country. Now, the police clearance certificate is simply a criminal clearance certificate from your home country that the police will state that so and so person has no criminal record or is not involved in any criminal record in our country. The police clearance certificate is the same as DBS in the UK, and it's also the same as Access NI in Northern Ireland. Bear in mind, as part of the recruitment process, you need a police clearance certificate from your home country. You also need to do your tuberculosis test at the IOM office, that is the International Organization for Immigration office. Now, we have such offices in most capital cities. The other one is you need your IELTS test. You need to do your IELTS test. That is the International English Language Test System exam. If you are looking to work as healthcare assistant in the UK, please bear in mind you are not exempted from your English exams. For the purposes of healthcare assistant, you can sit for the IELTS UKVI General. Now, having said all this, just bear in mind that some agencies may give you some additional specific requirements. Bear in mind that whichever requirement that they give you shouldn't include pay some amount of money. The application process is almost free. The areas where you pay money is not to the recruiting agencies. Now, having said this, let's go through which areas during your application that you have to pay some amount of money. So the first one is when you are sitting for your English test. Whether it is the IELTS exams or whether it is the OET exams, you need to pay for these examinations. When going for a police clearance certificate from your home country, you need to pay some money to the police department in your home country. The next payment is when you are going to do your tuberculosis test, you need to pay some money to the International Organization for Immigration. You have to pay money during your visa application, but wait, some agencies will take care of the whole visa application and pay the money for you, especially when you are applying directly to the health institution in the UK. They will take care of your visa application, they will pay everything. But sometimes when you are going through these recruiting agencies, they will let you pay your own visa fees. Then your health surcharge. The good news is the UK government, when applying for a visa to work as a healthcare assistant in the UK, will not take any money for the health surcharge. So the health surcharge is free. Then some recruiting agencies will tell you to pay for your flights. So after everything has gone through, they will not pay for your flight, you will pay it yourself. In your certificate of sponsorship, your care home has to state on it that they will take care of your personal needs in the first month or two. If they don't state on it, then you need to get some money on you, about 1,300 in the region there, about £1,300 in your account before you apply for your visa. So it is important, go into agreement with them that they will state on your certificate of sponsorship that in the first month or two, they will take care of your accommodation, they will take care of some personal needs. If they don't state that on your COS, you need to get that money in your bank account at least within 4 weeks before you apply for your visa. So just bear that in mind. Thank you very much for watching this video. Thank you. This is Nature and Lifestyle channel. My name is Mordecai. And please subscribe to my channel. I have a lot of videos for you about immigration, videos about nursing work in the UK, video about how a foreign nurse can be on the NMC register. I also have posted a video about 6 things, okay? 6 things you have to consider before you migrate from your home country abroad. I think that is actually the first video you have to watch, okay? That's the first video you have to watch. Thank you for watching this video. See you another time.